Artificial intelligence has rapidly evolved from a theoretical concept to a practical tool in spine research. Over the past 5 years, AI has moved beyond basic experimentation, now influencing imaging analysis, surgical decision-making, and outcome prediction. The spine, with its rich imaging and clinical datasets, is uniquely suited for AI-driven analysis. Early studies relied on classical machine learning techniques, such as support vector machines and decision trees, for tasks like vertebral localization and scoliosis classification. However, deep learning architectures have since emerged, enabling automated image interpretation and patient-specific risk stratification. Despite impressive internal performance metrics, challenges remain in generalizability and real-world clinical readiness. This scene sets the stage for exploring how AI is reshaping spine care and highlights the need for responsible integration into clinical practice. Since 2019, imaging analysis in spine research has matured rapidly, thanks to sophisticated deep learning models and large language models like ChatGPT. Early efforts focused on foundational tasks such as segmentation and localization. For example, the Spine Explorer program can automatically segment and measure lumbar MRIs in seconds, achieving high accuracy and agreement with manual measurements. AI models like SpineNet have matched expert radiologists in classifying disc degeneration and spinal stenosis, demonstrating diagnostic parity. Hybrid models now tackle complex pathologies, such as modic changes, and deep learning pipelines detect fractures in CT scans with remarkable sensitivity and specificity. The latest frontier involves multimodal integration and synthetic image generation, overcoming data heterogeneity and acquisition time limitation. These advances mark a shift from passive analysis to active enhancement of clinically actionable information, though challenges in validation and interpretability persist. Predictive modeling has become a major domain in spine AI, moving from descriptive statistics to individualized forecasting. Traditional scores like the Metastatic Spinal Tumor Frailty Index and Geriatric Nutritional Risk Index remain valuable, but machine learning models now incorporate these features for improved outcome prediction. Random forest and ensemble algorithms can forecast surgical complications, readmission risks, and even quality of life outcomes with strong accuracy. These models are operationalized into clinical decision support tools, providing consistent objective risk estimates that enhance preoperative counseling and shared decision-making. However, interpretability remains a challenge, as complex models often function as black boxes. Efforts to extract rule-based explanations are underway, aiming to build clinician trust and ensure accountability. The promise of AI in risk stratification is clear, but widespread adoption depends on generalizability, calibration, and alignment with real-world workflows. Unsupervised machine learning, especially clustering, has enabled qualitative phenotyping in spine research. This approach uncovers distinct patient subtypes based on comprehensive baseline data, moving classification beyond anatomical descriptions. Studies have identified prognostic phenotypes in adult spinal deformity and early-onset scoliosis, improving individualized care planning. Hybrid modeling integrates multiple data modalities, capturing the multifactorial nature of spinal disorders. Natural language processing (NLP) and large language models (LLMs) automate data extraction from electronic health records and analyze patient sentiment, offering new insights into patient experience and satisfaction. While these advances signal a shift toward integrative AI systems, their translational readiness is limited by challenges in transportability, interpretability, and data provenance. Ensuring ethical and reliable adoption requires ongoing validation and collaboration between clinicians and data scientists. Looking ahead, AI continues to display enormous promise in revolutionizing spine research and clinical practice. Advances in imaging, predictive modeling, qualitative phenotyping, and integrative frameworks have matured from proof of concept to matching or surpassing expert performance. However, high internal performance metrics alone cannot guarantee safe or equitable deployment. Persistent challenges in data quality, heterogeneity, interpretability, and context-appropriate validation remain. The future of AI in spine care depends on sustained investment in large multi-center datasets, dynamic validation strategies, and close collaboration between clinicians, data scientists, and regulatory bodies. Responsible integration will ensure that AI-driven tools remain reliable, interpretable, and equitable, supporting personalized, evidence-based care for patients across the spectrum of spinal disorders.